Listen up, fellow Democrats. Fight fake news and lies with facts. Save our democracy from right-wing hypocrisy. Keep our integrity, embrace our diversity. Whenever we're down, we always come back. So listen up, Democrats.
Hello, everyone. Welcome to Progressive Oregon, a weekly engagement broadcast on progressive issues in Oregon. My name is Larry Taylor, and I'm with my co-host today, Betsy Cunningham. If you would like to ask questions during the show, you can do so at the YouTube channel for Uphill Media. Type in your questions. Betsy will then relay them to us, and we will do our best to answer them. The topic today is healthcare, and we have a very interesting show lined up for you. At first, we're going to talk a little bit about data and where the U.S. healthcare system fits into the world of healthcare systems. Then we have two guests from Europe who's going to talk about the European experience with their healthcare systems. And then we have three people who are going to talk about where we are with healthcare in Oregon and what we need to do here in terms of next steps. So first of all, we're going to go to a video, and the video is going to explain the terminology that's used in this discussion, so we can at least communicate at that level. Are we ready for the video, John?
New poll out from the Kaiser Family Foundation on healthcare, and as expected, it's good news for the left. So they phrased this in a variety of different ways. They basically asked people what they think of universal health care, and they phrased it in a variety of different ways. And obviously the terminology makes a big difference, and it can make people respond positively or negatively. So let's go right to the elephant in the room here. When it's framed as Medicare for all, 62% of the American people have a positive view of Medicare for all. That is overwhelming. Now, when you change it to universal health coverage, that still has a very positive connotation to it. 61% of people support it. See, now this is where it gets really interesting to me, because these are not generally terms that are used or terms that are viewed favorably. But when you frame it as National Health Plan, you still get 56% who have a positive view of that. And then even when you do single payer, which historically has not had a positive reaction from people, you'd have to frame it as Medicare for all to get the positive reaction. But even single payer, if you crunch the numbers there, 48% of people have a positive reaction to it, 48%. And negative reaction is only, 46%? And I'm including the don't knows in the negative reaction, okay? So that's +2. If you get rid of the don't knows, then it's still like +16. +16 people prefer single payer, have a positive view of single payer. 16 points more than a negative view. So the only area where it gets murky is socialized medicine. But it's almost at the point now where I think if the conversation keeps going the way it's going, there will even come a time when people have a positive view of socialized medicine. Because just so everybody knows, I'm sure all of you guys know this, that's all the same thing. They ask the same question in a variety of different ways. Medicare for all is the same as universal health coverage, is the same as national health plan, is the same as single payer, is the same as socialized medicine. So they're just asking in a bunch of different ways. And my guess is the more time goes by, the more Bernie makes this case, the more other Democrats are now being forced to the position of being for Medicare for all, the more the left controls the discussion and the narrative on healthcare by giving people the facts and the information and the data about the healthcare systems in the rest of the world, the more people are going to go, oh, that's obviously the right answer. Because I think even without people making the case, it was like 51%. Then Bernie came on the scene and really made the case, and then it kicked up to 61%. So even without an argument being made, people had this reaction of like, yeah, I think the government should give healthcare to everybody. So forget it. When you actually have that plus people actually making a positive argument for it now, and now people are being educated on this topic across the country, That's only good news. The downside is, big money still controls our politics. So big pharma and for-profit health insurance companies have way too much sway over the direction of our healthcare system. And we got to get the money out of the system and listen to the people here. Because I unfortunately don't want to be in a situation like we're at with gun control, where over 90% of people want a universal background check, and we still don't get it. But my guess is that in due time, these numbers are heading in that ballpark, where like 90% of people are like, yeah, what are we talking about? Of course, Medicare for all, let's do it, and let's do it now.
Okay. John, let's go to the slides and just give everyone a sense of where the United States is in terms of quality of service and spending. So these are a set of slides that I have pulled off the internet, and they're readily available to everyone. The first one is overall ranking. Of course, the devil's in the details, but the results of these surveys seem to be consistent. So in the first one, the U.S. is 11th out of 11 countries in terms of healthcare delivery and the ranking. In the next slide, healthcare system performance scores. Again, the U.S. falls to the bottom. In the next one, life expectancy in birth years. So, in about 11, 12 countries, even though there's not a huge difference between them, we're in the aggregate, we rank at the bottom behind all the rest of the first world countries in the world. And then, of course, the shocking one is the slide that shows where we are in spending, where we're we spend twice as much for healthcare in the United States as the average country for the rest of the world. So we're spending the most, and we're getting the least dollar quality of service for the money that we spend, which is infuriating. As I'm getting older and entering the healthcare system, I'm starting to feel the impact of this directly. The next one, countries with universal healthcare. You can see that everyone from Argentina to Russia to Spain provide it, and we're not listed on the list as someone who does this. And of course, the next one, the rankings depends on the criteria used for the ranking. So we range everywhere from 11th on one survey to this one, where we're 37th in the world. And of course, it depends on what criteria they're used for ranking them, but clearly we're not doing so good. We have the best medical technology in the world, I can believe that, but it's our delivery system that is suffering. So today on the line, we have a couple of guests from Europe. We often hear the European system get demonized, but we never get an opportunity to hear citizens from these countries explain to us what their personal experiences with the healthcare system, and it's what it's like. And so today we have Dennis from Germany, and we have Katie from Luxembourg. Welcome.
Hello, everybody.
Good morning, everyone.
So it would be really great if you could help us understand in the United States what the healthcare system looks like from the perspective of a citizen. And we'll start with you, Dennis. So if you could talk about what the patient experience is for these three scenarios. So the first scenario is, you get the flu, you have influenza, you need to go to the doctor. The second one is sort of a middle case where you have a broken leg and you need to be treated. And the third one is where you have a curable form of cancer, which was probably the most expensive thing to treat. And so talk about things like what the process is to get healthcare, how you pay for it, how long you had to wait for it, that sort of stuff. So that we can get a sense of, here in the United States, what your medical system, how it performs.
Okay, that is a lot.
I know, I'm sorry.
Okay, where do we start? With how I pay for my healthcare, or where we start?
Just talk about, Dennis, talk about what a typical experience would be, right? I mean, in all of those situations, what is your copay and what does it cost to go to the doctor? Right?
Okay, let's shock you guys. There's no copay or deductible or anything like that when you go to the doctor here in Germany. And this is the same thing throughout Europe and all countries who have a universal healthcare system. We don't need to pay out of pocket 5,000 to 6,000 euros for dollars to go to the doctor's visit. If you're ill, for example, and take my, I take me when I'm, for example, influenza. I call the doctor. I get on the day an appointment. Go in, show my insurance card. They check it in. They see my whole history, my medical history, and so on. And then I wait 20 minutes, an hour. It depends how full the waiting room is. And then I get my examination. If I need medication, I get a prescription filled out, go to the pharmacy, and maybe I have to pay for the medicine. It depends on what kind of drug and so on. For most drugs, for influenza, I pay around 5 to 6 euros. That's around $8 to $9 for my whole treatment plan, for example. So we don't have this huge expenses out of pocket like you do in the US.
Interesting. So if you had something like a broken leg, what would that experience be like?
The same thing. Yeah, the same thing. I go to the hospital, get every treatment I need, meaning scans and so on. And if the injury is so bad that I get an operation, I have to operation and even a hospital stay. That's it. I don't pay out of my pocket. I paid with my contribution. I paid out of my paycheck. So therefore, I don't have to think about it. The only thing we have to pay out of pocket is for hospital stays. This depends on the hospital because our hospitals are mostly private run here in Germany. So we pay around $10 to $15 a day for a stay in a hospital. So this is all I have to pay out of my pocket for the whole treatment and so on, and for rehabilitation therapy and so on. This is all I have to pay.
And then in the final case, if you had something that's expensive to treat.
It doesn't matter, Larry. It doesn't matter. Here in Germany, in a universal healthcare system, it doesn't matter how much money you have. It depends how ill you are, what treatment do you need. We have a system based on treatment. We don't have to think about all the money part and all the stuff because all is covered. It doesn't matter if you're rich or poor. All people, the whole population in Germany is covered. If you're employed, unemployed, it doesn't matter. You're covered. So
Very interesting. So Katie, let's talk about what your experience is in your part of Europe.
Okay, well, first of all, just so the people aren't confused, I'm Irish, but I grew up in Luxembourg and I'm now living in France, but close to the Luxembourg border. Most of my life is there, and we're attached social security wise to Luxembourg, which is why I know the system a lot better. I agree with almost everything Dennis has said. It's the same in Luxembourg. Whether you have the flu, whether you have a broken leg, whether you have cancer, treatable or operable or not, you get everything you need. And it's very frustrating for us to see what Americans have to go through not being able to have all of that. But what I would say is if for instance you weren't feeling well and went to the doctor and you thought it was cancer, you'll go to your doctor, he'll send you for blood tests, he'll send you to the specialist, he will send you for all the relevant tests, no matter what they are. And then you go to the hospital and you'll stay in or come out and go back on a daily, weekly, whatever basis, whatever you need. It is needs-based. When you go to the outpatient with your broken leg, they'll take be one team who will take you in, who will ask you questions, and then who will be treating you at the same time, or at least evaluating the care they think you need. So then you have 20 people in the waiting room, and they take first the ones that most need it. So you may have to wait. The only thing I'd say is the hospital we go to, if you do have to wait, the seats are wooden, even though everything is modern and everything, it's most uncomfortable, but that's a detail. It's needs-based. So children or people with serious illness go first, and you may have to wait. What else? Everything insofar as, the first thing that went through my head when Dennis started to speak was, he was talking about the actual cost. I don't know the cost of the medications when I go get them. I don't need medication often, and I don't know because it's so little. When you get a bill, it's third-party payment, or whatever you call it in Luxembourg. In other words, the Social Security pays already for most drugs, medications, whatever. They pay 80% straight off, and that's off of a fixed price, which I presume they come up with the pharmaceutical industry. Yes. So they have a fixed price. They then pay 80% of anything that's important, and then you only have to pay the difference. You produce your little credit-sized card for insurance. You go to your local pharmacy. They call up all the details, as Dennis said, and you just pay the difference. And they can also range different things. For instance, I had to pick up something for one of my children the other day, and I have to ask for permission to get that medication, and so it takes a few days, but the child needed it now. So they gave me a box with just the relevant number until they would hear back. So a couple of days supply, because it's clear from their point of view, it'll be allowed, etc. The dentists, glasses, things like that are a little more complicated. They only allow you a pair of glasses, the frames and the glass, about every third year. If you want to get them more often, you can, but you'll pay. And there's a set amount they'll give you. And actually, frames in Luxembourg are very expensive, not these, but they can cost you a lot of money. That's not covered, but that's an extra. And dentists are much better covered now, but they weren't always. And if you want orthodontistry work done, that you better do that while you're a child, because up to the age of 17, nearly everything is covered. And but you have to ask permission, and it has to be organized beforehand, and it's covered, and you pay in about 3 phases over the time, and they'll divide that up if it's too difficult for you to pay in one go. But otherwise, they cover maybe 60 euros, so about $70 per year per person for regular dental checks, etc.
One of the things that we're told over here is one of the flaws in socialized medicine is that the wait times to get treated can be months. Do you know of any country or circumstance in Europe where that's actually true?
Okay, when we talk about hip replacements and stuff like that, that can take some time to get an appointment. Or if you have you need an appointment, especially in Germany, we have a lot of specialized doctors and specialized field. So to get an appointment, it's very hard. Sometimes you have to wait. But if you have a serious issue like cancer or whatever, you get treated immediately. Mm-hmm. Once again, it's the whole system is based on need, on how severe is this your situation is. Therefore, you get treated.
So share with us what the time frame would be. Like in my case, I had to wait for a specialist, and the wait was 2 months. So when you say a long time, is it more than 2 months or is it less than 2 months? Or
it depends on what. It depends on what issue you have and what specialists around you. Meaning, do you have a dentist, for example? Just an example. You then have a dentist in your town, and the next dentist is 2 or 3 towns away, and therefore all the cities around are running to this dentist. Therefore, the appointments are longer. But it's different from person to person and from issue to issue. You can't say this takes 3 months, this takes 1 week or something. This is very individual.
Sorry, Larry.
Oh, go ahead, Katie.
Eye doctors, that's awkward. I had a brilliant eye doctor, but the guy was a sociopath, and I changed, and it's very, very difficult to get a replacement. I have a replacement, but I don't know how good the guy is. That is difficult. And even though the French around where we are, they really have this thing about staying in France and going to their doctors here, the border is much more of an issue to them. They still will cross the border to go to the eye doctor because it's so long in France to get to see one. But most things, you're talking about specialists, you're talking about something that is not necessarily something you can't wait on. There you might have some kind of delay, but not for anything important. If it's important, you'll be treated immediately.
If it's life-threatening, it's immediate, right?
Yeah.
Definitely.
For example, my grandma got breast cancer, and she was treated the next day.
Yeah. My mother, the following day, operated. Yeah, that was in Ireland.
I meant operated and so on. Yeah. And she's now in hospital for 6 weeks. So, yeah, she's all right. She's recovering. We don't have to think about money in the whole process.
Yeah, and that's extremely stressful. When you really don't need that when somebody's ill and really ill in your family. To have to go through that, it's horrific. And we don't have that.
Yeah, you should focus on your recovery and not on money and do we get bankrupt and so on.
Yeah.
Betsy, do we have any questions from the line?
I don't see any questions, Larry. I think Betsy's involved with chat. They're having a good discussion, but I wanted to, before we get to the half hour here and bring on our other guests, I wanted to show a pretty important slide because this is the other thing that Americans talk about, and that's, well, you guys have great health care, but you pay ridiculous taxes and you know, all your money gets taken away by the government. So Dennis brought in an average basically the average income of a German citizen and what they would, and the breakdown of what it is. Can you run us through this, Dennis?
Yeah, of course. Hold on, I will go to the slide just so that I know what I'm talking about. Hold on. There it is. So yeah, as you can see, we have a typical German single man, his salary and so on. So we talking about like a guy like me, what we have to pay. So gross salary is 3,000 euros. Solidarity tax or surage is a special German thing because after the unification of Germany, we decided to get tax to rebuild the east of Germany.
Right. So Dennis, just to everybody understand, this would be like us paying a tax for an infrastructure bill or a works progress bill in America.
This tax is also used to build our green tech and so on, but this is another discussion. Then we go to church tax. So if you're Catholic or Protestant, you have to pay church tax. I don't. I'm Muslim, so I'm free from it. Then we have a salary tax. This is a progressive tax. So we can't say what percentage of your salary it is. It's how much you make. The more you make, the more taxes you pay. The lowest rate is 14%, and it goes up to 49% for people who make around, I think it's around 10,000 euros. After that, your tax rate doesn't go higher.
A month, then, Dennis? Is that 10,000 euros a month?
A month. A month. Yeah, a month.
Yes.
We're talking about the monthly salary, So then we have something special here in Germany. This is our social charges or social contributions. First of all, we have the pension insurance. Then we have unemployment insurance, health insurance, and care insurance. So this is something most of European countries have in other forms, but we all pay in it. So yeah, as you can see, I pay, if I was this person with a salary, around 252 euros for healthcare a month. this is around $280, $300. Yeah, and after all my taxes and so on, I have around 1,900 euros for myself, meaning for my livelihood to pay, as meaning rent and so on. And this is I can live comfortably with this. It's just a middle class income here in Germany, and yeah, that's it. So all the people you say, oh, you will pay so much in taxes and so on, but guys, all the fees, the co-pays, and all the things you pay extra, you can say there's also some kind of taxes, and you pay more, but you guys get less out of your dollars. So yeah, that's why I gladly pay this. And to everyone who says, yeah, single payer and so on is too expensive, no, it's how you structure your whole system. So therefore, I don't, as you can see, as Larry pointed out moments ago with the slide, we pay less, half of what you pay in the US. So therefore, I'm lucky. I would never change it.
Yeah.
So the other argument against socialized medicine is that the quality of care goes down dramatically because it's portrayed as a bureaucratic system where, you know, you're just someone in the queue and you get processed. Do you feel that you're treated as a human being in your healthcare systems, or do you feel like it's impersonal and more of a medical factory?
Yeah, no, not at all. I feel perfectly okay when I have to go to the doctor. I don't worry about anything like that, and you're definitely treated as a human being. Yes, depending on if you're taking a child to the hospital for something or other that isn't urgent, there could be a lot of kids there and a delay, but you know, it's as far as it goes. As regards all the information on the slide, yeah, by the way, I'm not a Luxembourg citizen. I'm an Irish citizen, even though I've lived in Luxembourg and France for years. As regards the costs and everything, it's less in Luxembourg. We're better off than that. If you're earning 10,000 euro in Luxembourg per month, so like, I don't know, what's 12,000 maybe dollars a month, you're only paying about 21% tax. And it's not just a matter, the costs in tax, the normal thing is to pay 2.8% for healthcare, 8% towards your pension, 1.4% towards dentists. It's called something else, but it's basically a dependence fund, whatever. It's when you're old, and you need some nurse to come to the house or to bring you meals or whatever. You pay for the meals, but the healthcare and the person to come by and everything, that's covered by that as well. So, you know, that's what, not even 12% to cover healthcare and pension. And on top of that, if you're in Luxembourg, there's health insurance. There's one, they brought them together in 2009. There's one fund for different groups that were working in the private sector, and 3 separate ones for the public sector, civil servants, I don't know how you call it, who are attached to a town rather than the whole state, and then the railway workers. They have different setups, but they're allowed 13 months, which is doesn't count towards the pension, but at the beginning of December, they get a double pay, a double salary check. In the private sector, there's even 14th, 15th month exist. I kind of heard about it, but I don't know any more than that. There's a number of other things. It divides down. Do you know, since 1901, healthcare for workers has been compulsory in Luxembourg. 1901. 1947, they brought in all those family allowances, old people's allowance, survivors' pension, and it doesn't, the person doesn't have to have worked for very long in the previous 3 years before they die, if they were ill or anything, for you to be covered. There's even an extra, there's a basically a guaranteed income, minimum income came in about 99. There are all sorts of things to make sure that you can't fall below a certain level. And the minimum unqualified worker wage in Luxembourg per month is about $2,000, and then it's maybe 2,500 if they're qualified, and then of course the more qualified you are, the more it goes up. But you're never allowed fall beneath a certain level, and you always have all the health coverage you need.
Interesting. So before we bring on our other guests, let's check in with Betsy. Betsy, did we have any questions on the line?
Jeffrey Pearson wanted to know about any income supplements for healthcare issues. So does someone get paid if they can't work?
Yeah. If you, I can talk about a German example. So if you can't work, if you're ill, you get a sheet of paper from your doctor. You send it to your insurance company and to the employer, and you are paid up to 6 weeks. Up to 6 weeks, you are paid the whole time. It doesn't matter how long you are ill, you are paid the whole time, but you get 60% of your salary. This whole salary is funded through the state, and 40% from your employer. So you get, for the 6 weeks, you get 100% of your salary. After the 6 weeks, you only get 60% of your salary. And this is whole funded from the insurance company and the state. So you don't have to worry about that you don't have any money if you get sick. And also, it doesn't matter if you work or not, or which employer you have, and so on. You are covered the whole time. So yeah, and you are free to go to we have around 113 companies here, insurance companies, and you can freely choose which company you want, which doctor you like, and so on. So
yeah. And in Luxembourg, you're covered by the employer for the first temporary disability. First 13 weeks, 100%. And after that, from week 14 for a full year, in other words, 52 weeks, the government covers you. And then you can't do that. It's not considered temporary if that reoccurs. It can only cover you for 1 year out of 2. So if you really have something, then you have to be assessed. And if they decide that you are seriously disabled and unable to work, then you are paid until you're 65, and then you get your pension. And that's the way it works.
Wow. Anything else, Betsy, from the line?
No.
Interesting. Well, why don't we bring on our other guests and talk about where we are here in Oregon. So we have Salome, who is based in Portland. We have Representative Rich Vial, who's in the Oregon legislature, who's sitting on a healthcare subcommittee. And we have Tom Sinzik, who's the president of Healthcare for All Oregon. Welcome. So Salome, why don't we start with you? Perhaps you could talk about how our experience compares with what was just described in Europe for things like getting the flu, getting a broken leg, and then getting something more severe with cancer. And I know it ends up getting very complicated in the United States because it depends on your circumstances and whether you're getting insurance through your employer and whether you're paying for supplemental or if you're just completely unemployed. But let's just talk about the experience of someone first.
Yeah, certainly. So we are, as a family of 4, buy health insurance on the open market. So it is not an employer-sponsored healthcare insurance that we have. And we buy the only gold plan that is offered here in Oregon. It is 0 deductible, and it costs us $1,400 a month. That is $1,400 a month for a family of 4 that we pay. It's through Kaiser, and we still have to pay $20 of copay to go to a GP, and I believe it's either $40 or $50 for a specialist. And in my case, I had to have hernia surgery this past December. And even though I'm paying the $1,400 a month, and even though it's supposed to be a zero deductible gold standard plan, the cost out of pocket for me ended up being about $3,600. That is after insurance had already paid. And I actually called ahead of time to Kaiser to see how much I would have to pay, because it's the holiday season and I just wanted to know, how much out of pocket I'd have to pay. They gave me an estimate of $1,500. A week before the surgery, they called to get my credit card information, and they said, no, it's actually $3,500. And I said, well, why is there a discrepancy and such a big one? And they actually said, oh, the person who quoted you forgot to include anesthesia for the operation. And so that's why it's now $3,500. And after all of that, and having paid all of that, I got another bill in the mail again around February saying I still owe another $500 on top because they forgot another anesthesiologist nurse that was in the room, and they had to bill for that. And it was actually through a tweet complaint that I made to Kaiser that they finally responded and followed up and said, oh, that was an error, and in fact you don't owe that additional $500. So we're back to the $3,500 now. And that is the experience. And, I see a lot of patients and healthcare consumers that think to themselves, if I only had more money to buy a better plan, if I had only bought the zero deductible plan, I would be in a better financial situation, or I would receive better care, or, the more you pay, you get what you paid for. And I'm here to tell you, I have the creme de la creme of insurance plans that is offered to Oregon consumers, and that is not the case.
That's very interesting, because I had a similar experience. I was supposed to be covered 100%, and yet I got a separate bill for the anesthesiologist, and I got a separate bill for a specialist that were somehow not covered by the 100% plan coverage that I was under.
Yeah.
All righty. Go ahead.
I just wanted to note that my procedure, I went in at 7 o'clock in the morning. I was home by noon. I did not have any complications as a result of this surgery. There were no infections or any further complications. So this was as routine and as standard as it got.
Wow. Well, let's bring on Representative Weil and Tom Sinsick. I don't have a lot of experience with the Oregon Health Plan, but a friend of mine just used it, and I was astonished at how good it was. So it feels like we actually have a better situation here in Oregon for at least some of the parts of the population than other parts of the country. Representative Weil, perhaps you could explain where we are now with the Oregon Health Plan and who's covered and how we're doing compared to like other states.
Well, I will tell you that the Oregon system is one of the ones that is looked to by much of the rest of the country. We're covering about 80 to 85% of Oregonians in one fashion or another now, and many of those are on the Oregon Health Plan. However, that's a source of consternation to the legislature. It is the largest portion of our general fund budget, and it is continually the one that is looked to in terms of how we might approach it differently. As a Republican, of course, my constituents constantly are saying, no new taxes. We don't trust government. We've got to make sure that things are being done more efficiently. But I will tell you that healthcare, I think, is becoming less and less of a partisan issue and more of a money issue. And that's the thing we've got to concentrate on. As we look at covering everyone, I think we're looking at the same time at the issues that Dennis talked about. I think Katie talked about them in terms of efficiency, where the billing gets to be so expensive, the process gets to be so expensive that it just exacerbates the entire problem. And if we can find a path to simplify the entire system, I think we'll be making real progress. And again, I don't think it's a partisan issue. I think that your comments, Larry, at the beginning of the show about the number of people that are interested in seeing us get there are shared in Oregon, absolutely.
In my limited experience with the healthcare system, it does seem to be incredibly inefficient in the way that it's organized, and there seems to be a lot of redundancy, which is where the waste comes in. But I can see where it's going to be difficult to drive that out with laws because you're interfering with commerce. Is there any way to address the issue of waste and redundancy?
Well, certainly there's ways. And looking at the single payer systems that have been tried in the US, we haven't found the way yet. But ultimately, we're going to have to find a way to avoid the tie-ins, the kickbacks, the rebates, the tax breaks, the picking of winners and losers that happens in our system. All of those things are going to have to go away. And Katie talked about the little credit card size card that you use. That's actually used in a number of highly developed countries successfully. And if we can begin to look at systems like that, I think we'll be a lot better off. Ultimately, Medicaid is something that has been successful in Oregon, and I think that it's quite possible. Yeah, Dennis is showing me his card now on another screen, but the reality is that Medicaid is a system that has had a great deal of success, and if we can overcome the real fear of people that they're going to be left out, that they're going to not be able to get their care in a timely fashion, I think we may find a path toward that eventually. I've got 13 children, 42 who call me grandpa. Healthcare is a big deal in my life. And there'd be nothing I would like more as a Republican than to be able to go to my colleagues in the legislature and say, look, we deserve better healthcare and we can do it more efficiently. We're not going to have to raise taxes. We're not going to have to take from education to get it done. Let's really get together with our colleagues on the other side of the aisle and get this done. And I think that's a conversation that's really beginning to make some progress here now.
Betsy, are there any questions on the line?
No, I don't see any.
May I ask a question?
Yeah.
Yes, Representative Weil, are there any plans as far as having private citizens like myself who are paying for health insurance out of pocket to actually buy into the Oregon health plan? Because that way then we would actually help, the survivability of that plan. And we're happy to buy into that plan versus what we're offered right now on the exchanges.
So there is a discussion going on right now to expand the Medicaid or Oregon health plan coverage to not just those who are poor or out of work or disabled or whatever, and expand that to where private citizens who are employed could become members of the Oregon health plan by paying a reasonable share, a share that would allow that cost to be equitably distributed.
Dennis or Katie, did you have any questions?
Not questions, but I would like to say what percentage of my wage I pay for my health care. I pay 7.3% of my wage for healthcare coverage, universal health coverage here in Germany. It's going right out of my paycheck, so I don't have it in the hand. It's right delivered, and yeah.
Yeah, and for us, it's 4.2 if you're just talking healthcare and dependency care or whatever way you word it in English, 4.2%. And And in Luxembourg, even though I think the highest tax bracket is maybe something like 43%, there's an effective tax rate that you pay, and I think it's more like 34, and that's the highest. Now, I know Luxembourg is a bit exceptional. It is a wealthy country, but the point is, and that's what everybody misses, like the French are always complaining because the money is hidden in Luxembourg and in Ireland. But I'm not questioning any of that. That's not it. But the Luxembourgers understood a very long time ago that if you want to be allowed, I suppose, be a good capitalist and get up the ladder and earn good salaries and whatever, you have to take care of your citizens. You have to give them a good standard of living. And then they're going to say, okay, so he wants to work 20 hours a day and make millions. Fine. I'd rather stay home with my kids after work or go to the beach or this or that. And so long as they can afford to have some kind of a comfortable existence, go on holidays once in a while, or even, God forbid, once a year, and go to the restaurant, the cinema, they're happy. And nobody kicks up. There are so many nationalities. The town that I'm often in when somebody's on to me in Slack in Luxembourg, just across the border, there are 34,000 people. There are over 100 nationalities living there. There is no trouble of any kind because everybody's comfortable.
So I think Dennis hit upon the proper way to view this. It's really, what is your total out-of-pocket cost instead of looking at taxes versus other things. I thought when I hit retirement age that I would go into the Medicare system and it was like, being home free. And then I get into the system and I'm finding out that it's complicated. I get a base Medicare enrollment, but then I have to pay for a thing called Part B, and then I have to pay for supplemental health care on top of that. So that I end up with something comparable to what I used to have when I was working for a corporation. And if I add all that together, it's a substantial amount of money, and that's on top of all of the taxes I paid since I began working into the system. So I've paid an enormous amount of money into the system, and it just seems like there's a better way to do it. Betsy, is there any questions yet on the line?
There's a question. Are there preventative care requirements for these single payer systems? By William Valentine.
What does that mean?
I don't know.
This is Tom. I could answer that.
Oh, go ahead, Tom.
If you look at the Oregon in 2013, there's a guideline passed and it's now in chapter, I think it's 712 of Oregon law, that is being used as the model for what the committee that Representative Weil is on, that calls and outlines the types of services that would be provided under an ideal plan in Oregon, and preventive services are completely included in that outline in 2013 Oregon law 712, chapter 712.
One of the things that is really troublesome to a lot of folks is that question of what would be covered. And of course, the devil's in the details, but we're looking at coordinated care organizations, for example, that are beginning to focus on preventative care. Coordinated care organization would be an organization that would be essentially the middleman for a lot of different providers. And while that system hasn't been completely fleshed out yet, we are looking extensively at things like preventative care, long-term focus, and really trying hard to make sure that people understand that things like wearing a bike helmet, not smoking, not texting while you drive, all have a big effect on our healthcare system.
Yeah.
Could I make just 2 points?
Sure. Go ahead, Katie.
One is under family allowances that you get in Luxembourg, there are a lot of different things covered. But one of the things is that when you are about to give birth, giving birth, after birth, you get a set amount of money. And you must go to the doctor. You must go through all of your, in order to get the money, you must go to all of your appointments and do all your checks and your ultrasounds and everything. So in terms of preventative care, everybody will have had to do that. And the money is substantial enough that they do in order to get it. And the other thing is about coordinated care. Luxembourg is a small country. It borders on Germany, France, and Belgium. And I've had to go to Brussels to a hospital with one of my children over years. And the care was all covered. And I was sent there by a doctor in Luxembourg who said that there are 3 hospitals in the general region that covered this specifically. And I would advise you to go to one of those. And he gave me the 3 names, and we decided on Brussels. In this case, one of them was there. And then you go through a process. They weren't too happy in the hospital I initially was in, but everything goes. All of the bills are paid. That's the hospital that specializes in that particular thing. Everything was paid. Tests, even mileage costs, as in train tickets or petrol costs, everything paid except the cost of the actual GP appointment, which, you know, didn't cost the earth. And that was it. Everything else is paid every time, and it's brilliant. And the other thing around here is, it's not that everything is 100% perfect, but there are things, politicians and others, they do try to tinkle around the edges and change where the money's coming from. And then when you work it all out, you realize you're getting a bit less and all the rest of it. All that's going on too. But in general, it's very, very good. And from where I am, I can go to Belgium, I can go to Nancy further down in France, I can go across to Germany, depending on the kind of care I need and where they specialize in that.
To bring it to the point. Here in Europe, especially, we look for preventive care because it's cheaper in the long run.
Yeah.
So if you're ill, you go to your doctor, you get the care that you need. That's it. We don't end up so much in the emergency rooms like it is in America because the people can't pay their normal appointment or don't get the medicine that they need and so on. So that's it. Yeah.
My guess
this is Tom. I'd like to speak to that sort of at a ground level as a nurse practitioner. Oregon has commissioned a study to find out why its maternal infant mortality rate is so high, right? Paying money, taxpayer money, to commission a study when, in my view, the obvious is if somebody, let's say, doesn't have health coverage and gets pregnant, then they have to go and sign up. So the first thing they have to do is go sign up. So instead of going in for services as early as possible, they have to sign up first and then decide what provider and then wait for the appointment. It's not right. But even before that, if they haven't been getting health care prior to pregnancy, this represents the biggest problem. It's really the preconceptual care that makes a difference from day one. It's not after you get pregnant, but what is your health status before you get pregnant? And so that's just kind of one example. And if you want, I'm happy to quickly talk through, from a provider standpoint, those 3 scenarios that you talked about. One is if a person, let's say, comes into a clinic at the school where I'm treating them for the flu, right? I take care of it. But the first thing that has to happen at the desk is, what insurance do you have? There's administrative burden right at the beginning, paid for by the tax dollars, right? Of somebody checking and finding out the insurance plan for that particular patient. But we can take care of them, no out-of-pocket expenses, because it's a school clinic kind of covered. Now we'll then bill insurance companies for that service, multiple insurance companies for that service. So additional billing time to try to collect back to recoup the taxpayer dollars from the insurance company. So that's scenario 1. Let's take a scenario of a broken leg. Oh, now it's complicated. Who is your orthopedist? Which orthopedic does your insurance company allow you to see? Now I'm spending provider time negotiating to find out which orthopedist they can see. Let's take something more serious, upper level. A kid that comes in that's suicidal. We have a suicide problem in this day, this country, big mental health issues. So kid comes in that's suicidal. I have a counselor or a therapist maybe right there, but that therapist cannot start the treatment because they're covered by a private insurance company. So I go and I say, oh, okay, let's find out a psychiatrist that's on your panel. I start to spend hours and hours instead of taking care of other patients and giving them the care they need when they need it. I'm caught up in the burden of finding the psychiatrist for a kid, even though I know somebody that will take this kid, but it has to do with who's paying the money. So we got from the urgent situation. And again, from my time as a provider, beginning to end, I always estimated in the course of a day, I could cover, see about 1/3 more patients a day, just giving people the care that when they need it and not worrying about them getting the care they need.
So we're nearing the top of the hour. I want to thank you all for joining us today. This has been a fascinating discussion and eye-opening, even though I thought I knew somewhat about the European systems. Tom, perhaps you could spend a minute talking about your organization and how people could get involved in helping your organization move legislation forward.
Well, thank you very much. My organization is Healthcare for All Oregon. We'll do the web thing, hcao.org, Healthcare for All Oregon. People can go there and get involved by just clicking on, it's called Statement of Support. They get into and then they get into the information loop. And there's a place there where people can tell their healthcare stories. And then we can share those stories out to the Oregon legislators. People need a formula for everybody understanding how complex this system is. Everybody, a way of explaining up the line how complex it is and how people are suffering every day with worry about so many things, and one of those lead worries is healthcare. And as I go along and talk to people at every business level, it's they all have the same story. Costs are rising. I'm not covered. There's a lot of workers in this world that are making wages that say, I'm not going to increase my wage, because if I increase my wage by $2 an hour, I will lose the Oregon health plan, because they're so worried about trying to improve themselves. So there's so many blockades. That doesn't really talk about our organization, but we know that together in Oregon, we can create a system where everybody is in, nobody is left out. And by the data, we can bring better care to more people for a lot less money. And I'm glad that really want to thank Representative Richard Weil for his work looking forward on this stuff. And I would, you have a minute, I don't know if you have a minute for Salome to talk out her work as a pharmacist or not.
I think we're out of time.
Do it, Larry, do it.
Okay, go ahead, Salome.
Yes, the pharmaceuticals were brought up as far as the cost in Europe goes, and I can tell you, I can't count the number of times I've seen where patients are at the counter at the pharmacy, and I've had a 10-year career of not being able to pay for their medication. In one instance in Washington, a patient had just been discharged from the hospital, type 1 diabetic. His copay for his insulin was $70, and he just couldn't pay for it that night. And the pharmacist dealing with him was the manager and was sending him away. You can't pay for it. I can't give you the insulin. And I actually stepped in and said I would pay for it out of pocket, because I just can't, in good conscience, let a type 1 diabetic walk away without their insulin. And so this is the state of healthcare we are in the United States.
Well, on that uplifting note.
Oh, wait a minute. Hey, Larry.
Yes.
First of all, Salome, I think that's frightening that we have to do that, and I wonder why pharmacists would be able to let people walk away. I have a question for Rep. Weil, and this is really for just reaching out to people who vote Republican. What can we do to engage in that discussion, and what is it going to take to get more Republicans to vote for this?
Well, this is certainly a very politicized issue on the national level, and I don't know what to tell you on the national level. I can tell you on the local level that the conversations have begun. Folks like Tom are critical to the process, and I really want folks to know how much we appreciate Tom's work. But we have to be patient with one another. We have to not be so shrill. We have to not be so demanding and accusatory that the party who may not agree with us 100% is evil. And I really think that if we can exercise that patience and continue the dialogue, we're going to avoid a fight, and we're ultimately going to get to a place where the story that we just heard about somebody who couldn't get their insulin is not going to be one we'll have to hear again. That's my hope, and that's the commitment that I've made to trying to work across the aisle on this issue.
Healthcare for All is a nonpartisan organization, and that's clearly where we need to stay.
Thank you for that.
Healthcare is a human right. That's it.
All right, back to you, Larry. Sorry, I just wanted to hijack that for a second.
Thank you, John. And again, thank you everyone for joining us today. We're going to be cycling through a number of these key issues that that everyone is concerned about in our subsequent shows. So stay tuned next week for the next one. We'll be touching on issues like immigration and homelessness, and we'll be going through these issues up to the election. Again, if you would like to get involved with our organization, there's two things you can do. You can donate to Uphill Media that provides the infrastructure for doing these kinds of conversations. The URL for donating is donate.uphillmedia.org. As I said before, if you could donate the cost of a macchiato latte grande that you drink once a week, we would be a wealthy organization. And then the other thing to do to get involved is with Advancement for Democracy Oregon. We're starting to work on our 2020 plan and our educational program on demanding your rights in a democracy. That's it for today's show. Anything you'd like to add, John?
Well,
Betsy?
I did pick a song, so I have that ready for you.
Excellent.
Betsy, you have anything you want to add?
No.
All right. This was a phenomenal discussion, and I just want to thank everybody for taking the time to join us, and everybody doing the work, Rep. Vile, everybody. This was great, and I was really impressed with the discussion. Thank you all very much.
Thank you.
This is a theme song for healthcare reform. This was actually done in 2009, and so that, it just gives you an idea. We've been at this a while. And one last thing, Katie. Germany's got Luxembourg built. Germany, 1881. So they beat Luxembourg in terms of starting universal health care.
Okay. Good for you.
This plan is your plan. This plan is my plan. Providing health care to all Americans from West Virginia to California. This plan is what our people need. Let's cover grandma, let's cover junior, every pregnant woman and injured worker. Expose the lies of Fox and Limbaugh. This plan is what our people need. Your plan, this plan is my plan, providing health care to all Americans from West Virginia to California. This plan is what our people need. Let's cover grandma, let's cover junior, every pregnant woman and injured worker. Expose the lies of Fox and Limbaugh. This plan is what our people need. This plan is what our people need.